Hello, everyone. I hope you are all staying safe, healthy, and are making the most of the current situation. My name is Alexandra Grudzinski, and I prepared a presentation for you all about magnetic resonance imaging, commonly abbreviated to MRI. Before we get into the current applications and future possibilities of MRI technology, we have to have a better general understanding of how it functions. MRI technology uses the hydrogen atoms within the water molecules that are prevalent in living tissues. These hydrogen molecules have a north and south pole that behave like a bar magnet and a rotational axis that the technology uses to its advantage. Naturally in the body, these protons are aligned randomly. But when the MRI machine introduces a powerful magnet and creates a magnetic field, the rotational axes of these protons align parallel with the magnetic field and create what is called a magnetic vector. Then the MRI machine introduces sequences of radio frequency pulses. These pulses cause a deflection in the magnetic vector and causes the protons to resonate and enter into a higher energy state. Then, once these radio frequency pulses are shut off, the protons return to their resting state and emit radio waves that the signal processing components of the MRI machine interpret into the grayscale cross-sectional image that you see on the other side. MRI technology is able to differentiate between different forms of matter because body tissue, abnormalities within the body, all take different times returning to their resting state after the radio frequency pulses are shut off. And the signal processing components are able to differentiate between the times. Because MRI machines use the water molecules within living tissue, they are best suited for imaging soft tissues within the body, including muscles and joints, organs in the abdomen, and the brain and spinal cord. For muscles and joints, MRI scans are commonly used to provide information on the state of an injury and determine whether surgery is necessary, and if so, what route would be best for this patient's certain condition. MRIs of the joints and muscles can provide information on dislocation, rotator cuff tears, bone fractures, and other sports-related injuries, including ligament tears in the knee. They can also detect joint diseases, including arthritis. MRI technology is also able to create cross-sectional abdominal scans. These help doctors detect diseases within the abdomen by examining the blood flow, the state of the lymph nodes, and detecting the causes of pain within the abdomen for the patient. MRI scans can help detect tumors of the abdomen and the pelvis, diseases of the liver and pancreas, inflammatory bowel disease, and abnormal blood vessels, also called vasculitis. The most common use for MRI scans are scanning the brain and the spinal cord. This is because the MRI is very efficient at differentiating between white matter and gray matter, which helps when detecting abnormalities within the brain, including tumors. Within the brain, MRIs can help detect aneurysms, strokes, tumors, and blood vessel issues. And within the spinal cord, it can help detect general spinal cord injuries and fractures. There are three main MRI machine types that are commonly used today: the traditional closed MRI, the open MRI, and the standard sitting, the standing/sitting MRI that's adjustable. The traditional closed MRI has been around since 1976, since the invention of the first full body MRI scan. It requires the patient to lie still and is being completely enclosed by the machine, yet it produces consistent high quality images. On the other hand, it's very uncomfortable for the patient because it might be very restricting, and it is very noisy and time consuming, which is why the open MRI was developed. The open MRI has the patient lie down, but they aren't completely enclosed by the machine. This is better for claustrophobic patients and patients who are clinically obese and would have trouble with the traditional closed MRI. The open MRI has, because of recent hardware advancements, has image quality that is comparable to the traditional closed MRI, which makes it a good alternative. The adjustable standing-sitting MRI is the best for patient comfort. However, the image quality is a lot lower than the other two and will need a lot more advancements in the future. MRI scans have multiple advantages and disadvantages when compared to other imaging modalities. MRIs are most commonly compared to CT scans because of their similar applications. MRI's advantages include the ability to acquire images in multiple planes, axial, sagittal, coronal, and oblique without repositioning the patient. It also includes having superior soft tissue contrast as compared to CT scans and plain radiographs, making it the ideal examination of the brain, spine, joints, and other soft tissue body parts. There are also advanced techniques and functions that the MRI has that the CT scan does not, including diffusion, spectroscopy, perfusion, and most importantly, functional MRI, which allows for visualization of active parts of the brain during certain activities. On the other hand, there are many disadvantages of MRI scans. MRI scans are very expensive, whereas CT scans are less expensive. MRI scans are very constricting for the patient. They are very noisy, time-consuming, which compromises the comfort for the patient, whereas CT scans are a lot better in that aspect. And there's another issue, which is time. MRI scans take a lot more time to scan than CT scans, so CT scans would be better in an emergency. One other disadvantage of MRI scans are the fact that patients with metal implants and foreign bodies aren't able to use MRI scans because of the safety issues. So CT scans would be the better option for those people. There have been many advances in MRI technology within the past 54 years. On the left, you can see the very first MRI scan from 1976, created by Sir Peter Mansfield, and the image below it is the MRI scan that was created of his research assistant's fingertip, and that was the very first MRI scan ever taken. On the very right, you can see the modern MRI machine, along with the high quality images that they are able to produce. So we have to address why we were able to make such leaps and bounds over those 54 years. First are hardware advancements. We have made many advancements in coils and magnets within the hardware in MRI machines. For magnets, the strength of magnets that are commonly used in MRI machines have increased recently. Before, 0.5 or 1.5 Tesla magnets were more prevalent, but now 3 Tesla magnets that produce a higher quality image, as seen between the two images on the top right, are more commonplace. Also, for coils, there have been great improvements. Today, the coils that are used to collect the body's MRI signatures are typically phased array, blanket, or flexible printed coils, rather than the bulky cage coils on the left that were used a decade ago. These new coil types have allowed for a better fit without restricting the patient and have allowed for the development of the open MRI and interventional surgeries. There have also been many computational advancements in the past decade. The use of artificial intelligence and computational analysis plays an important role in MRI acquisition and data processing. AI allows for faster image reconstruction and decreases the time that the patient needs to be in the machine. As AI has become more and more accessible recently, it has allowed for image post-processing to faster detect abnormalities and diseases in the obtained images. The main goal for the future of MRI imaging is to improve the quality of the images and decrease the scanning time required. Computational advancements provide the most promising route to that goal. Recent research into deep learning algorithms have shown that sub-Nyquist sampling strategies can improve image acquisition time and quality. The image below is post-processing of MRI data to remove the grain and improve quality. By further implementing deep learning and artificial intelligence into MRI scans, we can take the next step into the future of imaging and diagnostics. Thank you very much. You can now ask questions.